Well, thank you as always for choosing to spend your time with us. That is something we never take for granted. So glad that you are here, and I can't wait for you to hear today's episode. But just before we dive in, I thought I'd share a couple of ways that we can work together if you're looking to uplevel your negotiation skills, because I believe all of life is a negotiation. And if you want to negotiate your best life, I've got everything from online to group to my signature mastermind and VIP one-on-one experiences, so you can better leverage your innate power to get more of what you want and deserve in life. And if that sounds interesting or tweaks your interest, check it out at artoffemininenegotiation.com. And now on to today's program, the reason you are here. It is my great honor to introduce you to Dr. Andrew Kadar today. And we're going to be talking about negotiating recovery, renewal, and resilience after a major illness. So welcome, Dr. Kadar.
Thank you very much. Happy to be here.
And for those of you who may not know him, Dr. Kadar is a graduate of the Yale University School of Medicine, completed his residency at Stanford and Harvard, clearly not an underachiever. He's working as an anesthesiologist at Cedars-Sinai Medical Center. And he was very health conscious and fit, having competed at UCLA gymnastics team, running numerous 10Ks, and then got the shock of his life when he suddenly faced open heart surgery personally. And he's now dedicated to helping others develop resilience and negotiate better recoveries. So let's jump right in, Andrew. I think I read somewhere that you were determined to have the smoothest and fastest recovery from your triple bypass surgery in history. How did that work out for you?
Not so well. Before I went to medical school, I thought that doctors routinely exaggerated the amount of time it took to recover, because the guys on the gymnastics team, they would come back in half the time it took. The estimate was for them to recover. And when I had my surgery, I thought, okay, I'm going to do everything I can to recover as fast as possible. And one of the things that I was told is that you should move right after surgery. So I was determined to do everything maximally. But unfortunately, I had a whole bunch of setbacks and did not have the smoothest recovery. However, I have had a complete recovery, and in the last over 13 years, I've had no cardiac symptoms.
Well, congratulations. And I'm always interested, especially as somebody who's, had been practicing so long on that side of the table, if you will, what, if anything, did you learn from being on the other side of the proverbial operating table?
I think it's a lot more difficult to be a patient than to be a doctor. It certainly hurts more, and there are more obstacles, and it has that much more of an existential threat to your life as well. Yeah. So I found it quite difficult, actually, and there were many things that I wasn't expecting that came along. Now, a lot of the things that I wasn't expecting were actually things that were known complications, but they don't happen to everyone.
Yeah.
And when it happens to you, it can be a bit of a surprise and difficult. I can give some examples of that if you'd like.
Yeah, sure. I'd love to hear that.
Okay. I mean, after heart surgery or after any kind of surgery in the chest or the upper abdomen, it's known that some people have hiccups afterwards.
Yeah.
And usually I was told that the drains were irritating an area of the diaphragm, and that was probably what was causing it. But when my final drain came out, I had an attack of hiccups like I'd never experienced before.
You mean actual hiccups? I thought you meant hiccup in the colloquial sense, like, oh, you had some problems. You mean actual hiccups. Okay.
I had actual hiccups, but I mean, I had hiccups on top of hiccups.
Oh, no.
I had a blitz of hiccups like you can't believe. And now, when I was in medical school, I learned that hiccups are usually a minor nuisance, but they've gone on in some people for months and years. Wow. And they've even caused death when the diaphragm becomes so exhausted that people can't breathe adequately. Now, when I first read about that in medical school, an attack of killer hiccups sounded to me like the attack of killer tomatoes. It was, who are you kidding? But when I had these intractable hiccups that even with treatment just couldn't stop for a day and a half, it was quite an ordeal.
That's incredible. My gosh. Now, how did sort of having the patient experience with such a serious surgery, did it change the way that you then went on to practice?
I think minimally. I mean, I think I have more of an understanding of empathy for people who are kind of walking slowly down the corridor carrying an IV pole. But in truth, I think there's a lot of emphasis in my medical school training on being an empathetic physician.
Right.
So, however, it's one thing to know about it in theory, it's quite another to experience
Yeah.
it. And
Yeah.
so I think there is an increase in empathy when you've gone through it.
Yeah. I love that. And I'm a big believer, as you may know, I mean, a big part of the art of feminine negotiation is about bringing that empathy to the table. And in my experience, at least, it gets better outcomes. Have you found that since you sort of increased that empathy factor, has it changed your outcomes or your experience with your patients, do you think?
You know, I think I've always had good experience with
Nice.
patients.
That's lovely.
You know, I think one of the things that I mentioned is that when I was in medical school, one of my mentors told us that in a medical setting, everybody is addressed by their first name. You know, it's Joe or Pete, even by 20-year-olds talking to 60-year-olds. And when I was a patient, I was addressed by my last name, was Dr.
Yeah.
Kadar.
Yeah.
And I think that was the one difference in the way I was treated versus other people.
Okay.
And however, I always call people by their last name. I always say Mr. or Mrs.
Oh,
So-and-so or Dr. So-and-so,
yeah.
because one of my mentors basically told us when you meet a random stranger, you generally address them by their last name, particularly if it's an older person. And so it's more respectful.
Yeah.
And his statement was, don't your patients deserve as much respect as a random stranger?
Yeah. Oh, that's an
So,
interesting
so
approach. Yeah.
usually in the operating room, everybody calls somebody Joe or Mary, and I'm the one who's calling him Mr. Jones.
Yeah. Well, and it's funny because I just had this conversation in another context recently where it came up about like a lot of languages, certainly French, Spanish, many other languages have sort of a formal and an informal pronoun use, et cetera. And we don't really have that in the English language, right? Like, that tu versus vous. And we don't, so maybe there's one way around that is using that more formalized last name. I'd love to talk a bit about your experience around denial. Like, did you have symptoms that you ignored? Do you find that people tend to shrug off symptoms until maybe it's too late? What's your experience around that?
Yeah, I think denial is quite common. It's common enough that in medicine we say denial is not just a river in Egypt. And in my case, the triad that's most characteristic of heart disease is chest pain that comes on with exercise and goes away quickly with rest. I was working out in the gym, and about 9 minutes into a pretty intense workout on the elliptical, I started feeling some burning in the center of my chest.
Hmm.
And I thought, oh, that's kind of strange. But I don't have heart disease, but I'll knock it off today because I don't feel well.
Yeah.
3 days later, the same thing happened.
Uh,
And I thought, okay, I know I don't have heart disease. I'm really very healthy. I
yeah.
mean, my self-image was that I was superbly healthy.
Yeah.
But what would I tell anybody else who told me this same history? And then the answer was obvious. Yeah,
Yeah.
get it checked out. Don't be foolish. And I think that's kind of a valuable lesson because it's not just heart disease. This lump is not so big, it's
Yeah.
not so hard, it'll probably go away, and then the cancer spreads.
Yeah. Yes.
Now,
Yeah.
I don't want to spread paranoia because not every chest pain is heart disease. The vast majority of chest pain is not heart disease. It can come from gastrointestinal things, heartburn, muscle strain, lots of things. But if you have the characteristic chest pain that comes on with exercise, goes away with rest, then that's worth checking out.
Yeah. Yeah. And there's no downside to that, right? So it's just a smart strategy. Now, the art of feminine negotiation is all about collaborative approaches. I'm a big believer in that. And I think we've been very conditioned, whether in business, in law, and I don't know about the medical field. What's your experience, or more importantly, I guess, what's your advice about the role of collaboration in the recovery process?
Oh, it's very much a collaborative process. First of all, you need to communicate with your doctors, your nurses, and also your family members, your caretakers outside of the medical setting as well. And you need to be considerate of all those people. Patient who's quite sick needs a fair amount of help. And it's difficult when you're in pain. You may not be at your personality is not always at its very best
Yeah.
when you're
Good call.
struggling. But I think you do have to be considerate of everybody who's involved. Nurses and doctors their purpose is to get you well as quickly as possible and as well as possible.
Yeah.
And certainly there's caretaker exhaustion syndrome on part of your family members. If you're demanding day and night care from your spouse or whoever's taking care of you, they're going to get exhausted and resentful. Whereas if you have a mutually respectful relationship, it can bring you closer together. Fortunately, in my case, my wife was wonderful. And I think if anything, we spent more time together. And she's told me that sometimes she misses that
Aw.
since I wasn't working, she was taking time off from work. So we had a lot more time to talk and to interact, and a good time for our relationship.
That's a beautiful testament to how you guys handled it, because to be thinking fondly about that time together during what must have been a very challenging and frightening time is quite the testament. And it's funny, I was just today, ironically, at the hospital meeting with a surgeon about a possible hip surgery, and he said to me, "Look, sort of post surgery," he goes, "Do you live alone, or do you have somebody who lives with you?" And I said, "Yeah, no, I'm married. My husband will be there." And he said, "Because you're definitely going to need somebody to care for you." I said, "Oh, those are two things are not the same." My husband was quite offended. He's like, "Of course I could care for you." So now, what are some of the knowns and unknowns about recovering from a major illness?
Well, in any kind of an illness, there are known complications that can occur.
Yeah.
For example, after heart surgery, you can have arrhythmias, you can strokes, and so on. Obviously, not everybody gets those things.
Yeah.
So those are kind of the known unknowns,
Yeah.
because you know that they can occur, but you don't know if they're going to occur for you.
You.
And I had several of those occur for me.
Yeah.
And then there are some that you might not know about. In my case, the one thing that surprised me is after surgery, I had a great deal of difficulty swallowing.
Yeah.
So every meal was just a dreadful and ugly experience, because I would cough and sputter and retch and just it was pretty ugly and awful. And although that's to the ENT person who came to consult on me, he knew about that happening after heart surgery, but I didn't. So to me, it was an unknown.
Yeah.
And it was until I found out that can occur, that it's not anything unusual. It was very reassuring to me, especially since he told me that he'd never seen it last for more than a month. So I thought, okay, a temporary setback is not as bad as something is permanent. But I think a lot of times if people get a complication and they're not aware that it's likely to go away quickly, then they're going to be more worried about it. And so that's a communication from the doctors to the patient that's really necessary. And although I'm a physician, that was not a complication that I was aware of before my surgery.
Yeah. Well, and you raise a good point, because I often speak about in negotiations in the broader sense, preparation is so important. And yet it's funny with our healthcare, I think we often don't prepare by making sure we fully understand the pros and cons. Like today, this surgeon, I'd heard, "Oh, you're going to get your full range of motion back. It's going to be the greatest thing ever." And he was like, "No, this can happen. This can happen. This can happen." I was like, "Whoa." And my poor son recently had surgery on his wrist, and he had gone, with his girlfriend for the surgery. And then I went for his post-surgery, and the surgeon starts talking about all the things he can't do. And I'm like, "He works in construction." And the surgeon's like, Oh, no, no, no. He can never do that again. And my son said nobody had talked to him about that. And he hadn't asked, right? So you talk about that known versus unknown. So I'd love them. What are some of your top tips? Because I know you're a big advocate of sort of having that best recovery options and resilience. What are some tips you can share with our listeners about how to best recover from a serious illness?
Well, I think the first thing is obviously the first negotiation is with yourself and admitting that you have a problem,
Yes, so
because
true.
no medical person can help you unless you go to them for help.
Yeah,
So that's the first part. And then I think you have to understand that it's a collaborative process,
yeah,
and be respectful of your doctors and your nurses. I think the worst thing is a patient who's hostile to you.
yeah,
You,
yeah,
you, I never go to a patient wanting to do them harm. Obviously, I want to help them,
yeah,
but occasionally you meet somebody who comes on in an overly demanding manner, as if you were their enemy,
yeah,
which makes no sense.
yeah,
So, so I think the first thing to understand there is that this is very much a collaborative process, and it's in everyone's best interest for you to recover as well and as quickly as possible. For your caretakers, your doctors, your nurses, your therapists, it's not only the humanitarian thing, but it also enhances their reputation.
yeah.
So your goals are perfectly aligned.
Yeah. That's great advice. And it's funny, two things jump out at me from what you're saying. And one is, like, as you were saying about that hostile, and I know exactly what you mean. I've seen that so many times. And in my experience, that often comes from fear, right? When people come from a place of fear, they can tend to lash out. And I actually interviewed somebody relatively recently who was talking about that tying back to what we were saying about empathy, that he always, whenever he's confronted with that, he immediately thinks, okay, what is the fear that's driving this behavior? And it allows him to sort of show up differently. And the second thing that really jumped out at me is, again, going back to this idea team. So I want to really put a pin in that for our listeners out there. Make sure you've got, like, not only your medical team, but Andrew was talking about, you want to make sure that you've got that support team of your caregivers, and realistically assess it. Like, my husband, not the best. I had my ACL surgery. He picked me up at the hospital. I literally had just been up for the first time, like 10 minutes before he picked me up. And he sort of takes off and leaves me struggling behind. Caretaking, not his forte. Caregiving. So have a team that really works with you. Now, do you have any tips when you're talking about working with the healthcare professionals? I mean, there's a lot of negotiations, if you will, involved in navigating today's healthcare system. Any tips on how to get better outcomes in those interactions?
I think telling clearly what bothers you, and basically a very important part of medical care is getting what's called the history. What's your chief complaint? How long has it been? And its characteristics. And your doctor will ask you a number of questions about it, but clearly trying to define what's bothering you and what can help is going to be part of it. Now, there were several times during my hospitalization where I did some negotiations. Some of it worked out well, and one time I kind of embarrassed at the way I behaved.
We all have those moments.
But well, in my case, all right, I'll talk about that. In my case, at the hospital, they put on wristbands to warn doctors and caretakers of what's going on. For example, if somebody is difficult to put an airway in, an intubation,
Okay.
it's called the breathing tube.
Yep.
There's a one color there. And one day I woke up and I noticed there was an armband on me that said that there were balance issues, that
Yeah.
I needed to be looked after carefully so that I don't fall. Now, I'm a gymnast.
Yeah.
I have superb balance. I was proud of the amount of balance I had, and I thought, what the heck is this?
Yeah.
Why do I have this on me? This is ridiculous.
Yeah.
And there was actually a bit of a communication problem all around, because my nurse thought that it had been put on the night before, and she didn't know why, but she needed a doctor's order to take it off.
Yeah.
And, to me, it was like, suppose you had a musician and all of a sudden they woke up with an armband that said tone deaf. So I was upset by it. and I kind of made a scene about, get it off. And I, it just bothered me, and it made no difference.
Yeah.
But I kind of made a scene about getting it taken off. And later on, I found out that it wasn't even the night nurse. Unbeknownst to me, the hospital has come up with a policy that everybody, before they go into surgery, has one of those put on. And because under anesthesia, you're going to have a potential of falling. But this was days later.
Yeah.
And it was totally unnecessary in me. And if there'd been some clear communication all around, we could have avoided it, being upset and being upset at the nurses. So.
Yeah. Well, and what a great point that is, communication, right? So often I've seen it certainly in my legal career and well beyond in our intimate relationships and our familial relationships and navigating the healthcare system. When we don't make the effort to make sure we've got clear communication, things just fall off the rails. My daughter had open heart surgery as an infant, and oh my gosh, every day there were these important miscommunications that really did matter, right? They kept telling the team as they'd come around that she'd already had a failed attempt to do an extubation, and it was erroneous information. And then they made all these other decisions based on that erroneous fact. So having that communication is really important. And on that, I'd ask, what would you suggest if you hear the complaint sometimes that certain doctors, and I'm sure you were not one of them, but that they don't necessarily listen to the patients because their expectation is, I know it, I've done it a million times. Do you have any strategies on how to negotiate with a doctor who you feel may not be listening to you or believing the concerns that you're raising?
Well, one of the things is to find doctors that are going to listen to you.
Good
I
call.
think part of the thing that helped me is that I was at the hospital I worked at. I knew the guys that were taking care of me.
That's
I knew
handy.
they were all good. I'd seen them take care of patients. So that I think was an advantage for me. But I think anybody can find doctors that they can trust,
Yeah.
and will listen to them. I think if you are having difficulty like that, and this is your doctor that you need to stay with, then I think explaining things in a calm and rational manner is probably the best you could do.
Yeah. Yeah, that's great. And don't be afraid to vocalize it, right? Rather than letting yourself get agitated and then show up from that place. Now, you had mentioned about negotiating with yourself before, and I am a huge advocate of that. I often say our first and most important negotiation is our own mindset. Do you have any tips for our listeners on how they can negotiate their mindset to help them step into the fullness of their power to help their recovery?
Well, I think, my first negotiation with myself dealt with the denial. Okay,
Yeah.
do I really have this?
Yeah.
But I think along the way as well, I kind of had to recognize as I was in pain, moving around, all kinds of tubes coming in and going out, and walking slowly and so on. I had to recognize that I had some limitations in what I could do. But it kind of works both ways, because when I was in physical therapy afterwards, I thought I could do more than the nurses there wanted me to do. And so we had to kind of negotiate and tell them, I really am able to do more than this. Let me go ahead and try it under these circumstances.
Yeah. Yeah. That's a great point. As you're saying that, I recognize there's negotiations at every step in the process, right? Starting with negotiating with yourself, negotiating to get the right doctor that you feel comfortable with and that you have that trust with, negotiating to speak about what your concerns are. And then even in that recovery phase, negotiating about, what your levels of progress are. Now, I know you've got, yeah.
I just want to say one situation where the negotiation worked out fairly well. After heart surgery, one of the things that you're given is a potassium tablet, reduce the chances of having a rhythm disturbance.
Okay.
And the potassium tablet was giant. It was the size of a submarine, I think. It was a white submarine. And ordinarily I don't have any problem swallowing big tablets. But after surgery, when I could hardly eat anything, this thing was just driving me nuts.
Oh.
And I kind of had to negotiate getting a pill cutter.
Yeah.
because apparently the nurses weren't allowed to cut the pills for you, but you could cut it yourself.
Ah,
And I'm not sure what the rationale for
yeah,
that
I
was.
was saying.
But, and on top of that, they weren't allowed to give you a pill cutter either to do it yourself.
Really?
Fortunately, I had a pharmacist friend of mine who snuck one to me after getting me to swear not to reveal his or her identity. But even cutting him in cutting this thing in thirds, I was having a lot of problem with it.
Yeah. Wow.
So, but my potassium was at a normal level. So after a few days, when one of my cardiologists came around, I told him, look, this is giving me a lot of problems. Can we get rid of it? Can we not do it unless I have a low potassium detected?
Yeah.
And so he told me, yes, but you know that there are increased chance of a heart rhythm problem with this. I said, yes, I'm aware of that. And if I have one, I'll be happy to take it then. But, but I don't have any arrhythmia now. My potassium level is normal, and this is causing me daily misery.
Yeah.
Can we try without it?
Yeah.
And he thought about it for a couple of seconds and said, okay, let's try it. And
Yeah.
that essentially removed daily misery for me, or actually maybe a couple of times daily misery,
Yeah.
taking that tablet. So you can negotiate by giving him, it's in most cases, it's best to take that tablet.
Yeah.
But in most cases, people aren't having the swallowing problem.
Yeah.
So since I had a particular problem, by giving my cardiologist that extra information, that changed the treatment, and it changed the treatment for a way that was much
Yeah.
more comfortable for me.
Yeah. I see that two great takeaways from that I get. And again, for our listeners, just to put a pin in it for you. One is to ask. We so often stew or gripe or sit in silence and make assumptions that may or may not be ask for what you want, right? It's the first big takeaway I took from what you just said, Dr. Kadar. And also be prepared to get creative. I love that okay, they're not, nurses aren't allowed to get it. I'm going to find a creative way around this. And when that still wasn't, again, coming back to that asking, right? Ask and have the conversation. What if we try this and find those alternatives? Such a simple thing, and yet so often overlooked. And I want to make sure we get a chance to plug your book as well. So what's one of the most surprising insights that you had in either researching or writing your book, which for our audience out there, it's called Getting Better, A Doctor's Story of Resilience, Recovery, and Renewal. So what's one of the most surprising things that you found when you were writing it?
I don't know if surprising, but when you have a life-threatening experience, you do have a tendency to re-examine your priorities in your life. And I think in my case, I want to make sure that I have a positive impact on people. So I do compliment people more than I used to.
That's
And I
nice.
do try to be kinder than the kindness is something that should be part of my everyday life.
That's beautiful. I love that. I love that. That's very nice. And we'll make sure to put in the show notes as well. So for our listeners out there, make sure to check out the book. We all deal with the healthcare system at some point in our lives, for ourselves, for our loved ones. So make sure to check out Getting Better, A Doctor's Story of Resilience, Recovery, and Renewal, so you can pick up some more hot tips. And Dr. Kadar, I normally like to end by asking, what's one of the greatest mindset shifts that you've had in your life? You just talked about the kindness, which is kind of a mindset shift as well. But any other mindset shifts that you've had? It doesn't have to be on this topic at all, but something that made you go, and look at something differently, show up differently in the world.
Gosh, there've been so many during my life, but I would say that, and it does relate to this, I'm not as invulnerable as I thought I was.
That's a good one. That's profound. That's true, because we do. I'm thinking as I'm flashing before my eyes here about my boys too. They're at that state, then those early 20s or late teens when they just believe they're invincible. But it's not just subject to that. I think same, like, as I'm getting older now, it shocks me every time anew when something in my body is not working the way that it should. It's a bit of so that is an eye opener, and again, a great message for our listeners to make sure you've got plans, that you take steps when you notice those things, right? Don't be in denial, recognize them, go ask for what you need, get that collaborative team together that you need so that you can take steps to have the resilience and and most seamless recovery possible. So where can people learn more about you, Dr. Kadar?
I think just get my book.
Okay. All right. Well, we will make sure again to put that in the show notes so you can all check that out and make sure you spread the word. And thank you so much for spending your valuable time with us here, Dr. Kadar, to share your experience and your incredible knowledge and expertise so that our listeners can have a better experience negotiating their best healthcare. So thanks for joining us.
It was my pleasure.
And for our listeners, I have no doubt there was just a ton of value in this episode. Make sure that you go back and re-listen and take notes for yourself if necessary. But as always, give the gift of sharing as well. Share this episode with other people who can benefit from that. And again, that is really everybody because we are all affected by our healthcare for ourselves and those we care about. So check out the book, share this episode. Make sure to subscribe if you haven't done that yet. And also be sure to grab my Art of Feminine Negotiation book if you haven't got that yet. It's how to get what you want from the boardroom to the bedroom so that you can negotiate a better life. And that is a wrap for this episode. So until next time, go forth and negotiate your best life on your terms so you can stop missing out and start getting more of what you want and deserve from the boardroom to the bedroom. Until next time, take care.